and welcome to Hatching for Health, the Jessica Hatch Show. Tonight's guest is going to be Nicole Minger. Now, she has a little girl named Landrie who is just 6 years old, and she has been diagnosed with not only one, but 3 rare conditions. These are known as laryngomalacia, bronchiomalacia, and trachomalacia. So we are going to dive deep into understanding exactly what these conditions entail and how she was diagnosed. So Nicole, thank you for joining us this evening. How are you?
I'm good.
Great, great. So you have your hands full, it sounds like, with your little girl and all these conditions that she's going through. So tell us a little bit about, just as a family, when this diagnosis happened so that we can then dive into, exactly how she was diagnosed.
When she was born, she seemed fine. About the only issues we had was feeding issues. She really struggled with feeding. It would take a really long time for her to finish a bottle. She was unable to breastfeed, so we had to move to bottle feeds, and she would take a really long time. And we honestly couldn't figure out why it was taking her so long.
Mm-hmm.
We were kind of thinking we had a lazy baby on our hands. But after a while, that started to get a little better, and she was able to take on the feeds, but she still gained weight very slowly. Around a month old, I started to notice some symptoms of this noisy breathing. It wasn't all the time, it was here and there. So wasn't sure what it was. And then I also noticed she started to have reflux symptoms too. Talked with her pediatrician, and her pediatrician kind of thought it was just all reflux related. They put her on reflux meds to see if that would help. It did help the reflux symptoms, but it didn't help the noisy breathing that continued. Was going to talk to our next appointment. We were about a week out from her next appointment to kind of discuss that the noisy breathing was still going on. She honestly appeared fine otherwise.
Okay.
Just this odd noisy breathing.
Yeah.
Then about a week before we were back at the next appointment with the pediatrician, she was almost 4 months old. That noisy breathing kind of turned into her gasping for air.
Oh,
you could tell she was struggling. She turned blue in my arms, and then she stopped breathing completely and went completely limp. We had to do CPR on her. Thankfully, we were able to get her breathing again.
Wow.
And then they took her, to the hospital.
Was the CPR done at home?
Yes.
Okay.
Yes, her dad performed CPR on her and was able to get her breathing again. Was able to get her breathing before the police or the ambulance showed up. They did take where we lived at. It took a while to get there.
Okay.
So by the time they arrived, she was breathing again. Then they went ahead and took her down to the hospital, to our local children's hospital. When we talked to the doctors there and just said about the noisy breathing and just the difficulties with feedings, and they suspected the laryngomalacia.
Okay.
Which is in the larynx, where your voice box is, your vocal cords in that area.
Mm-hmm.
The tissue gets floppy. So there's extra tissue, it gets floppy, and it flops over the airway when the child breathes out.
Okay, which kind of explains.
On the inhale, it would flop over, blocking off the airway.
Okay, which is partly
so the doctor said,
the feeding part too, like her not, feeding fast, because it's basically probably flopping around and not allowing her to really be able to feed properly.
She wasn't able to coordinate that suck, swallow, breathe technique that most babies do need to figure out at first, but for her, with having that, it made it even harder for her to get that sequencing down. So the doctor, it was an ENT, is the doctor, he performed a bedside scope And they put a scope down the nose, down to into the throat area so that they can view the larynx. And he did say she had moderate to severe laryngomalacia.
Wow, and this
And
is
he
at 4
said
months old.
yes. And he told us that like reflux makes it worse because with the reflux coming up, it's acidic and it can irritate and inflame the throat even more, causing that area to be even more narrow and causing more issues. So he said we needed to make sure we had her reflux under control. So they ended up putting her on another reflux med. So now she's on 2 reflux meds.
Okay, so this
they
is
released
just,
us.
yeah, just 4 months old, and you've got, you know, from 1 month you knew there were, you know, different conditions going on, but nobody diagnosed it. It was just, you know, put her on this medicine and carry along. And then, you know, a few months later, obviously serious enough where she could have lost her life had your husband or yourself not, you know, done the CPR. So that at that moment, at 4 months old, the first diagnosis of the laryngomalacia was, in fact, I know, I'm like, these are not the easiest names to pronounce. So, okay, so then y'all got put on another medication, but no surgery was done. It was more of something that they said you could, you know, work through.
Yeah, the doctor's pretty much like, okay, you know, it's not that big of a deal. You know, it caused some noisy breathing and these issues. If we get the reflux under control, she should be fine. Sent us home without really too much urgency. I had asked the doctor, I wanted a monitor for her at nighttime because I was terrified that she would stop breathing in the middle of the night. They said it would make me more anxious and she didn't need it. So they sent us home without anything. About a week after we got discharged, we ended up going back to the hospital. She was in respiratory distress. She was having a lot of like breathing, very noisy. She was retracting in and around like the throat area. You could see it pulling in. And just seemed to be like her breathing was rapid. I mean, wasn't right. She was in daycare at this time, and like the daycare had noticed also, and they were concerned. So I went ahead and took her into the emergency room. They had her readmitted again for observation. Overnight, they said her oxygen levels kept dropping throughout the night. She wasn't maintaining her oxygen. So they decided to do emergency surgery for the laryngomalacia. That surgery is called a supraglotoplasty, and it's where they kind of trim that excess tissue in the larynx to help open it up.
Okay, is that performed by an ENT?
Yes, ENT performs that. So the next day they went ahead and performed this they put her on as an emergency surgery. Afterwards, they come out and said the supraglotoplasty went well. They were able to trim the tissue and everything. During the surgery, they went ahead and did bronchioscopy, which is where they take the scope and they take it deeper down. They take it down into the trachea. And they can take it, if they have a flexible one, they could take it all the way down into the bronchioles too, to kind of check the whole airway to see if there was any other issues. When they put it down there, they noticed that there was a very severe narrowing in her trachea. They couldn't even get the scope past it. It was so narrow.
Oh my gosh.
They come out and told me they suspected she had an artery compressing on the front of her trachea. So she went in afterwards for a CT scan, and it did reveal that the innominate artery, which comes off the top of the aorta, was coming off at a little bit shifted further than what it should have been, so it was then pressing on the front of her trachea severely.
So
they told us.
So she's at this moment, I mean, she's still under 5 months old?
Yeah, she was just over 4 months old when she had surgery, and then they found this.
So you guys, I mean, this all happened really in an emergency situation. You go to ER, they determine we need to go into surgery tomorrow morning. Was your husband there at the hospital with you?
No.
Okay, so you were by yourself?
Yes, I was by myself.
What was that moment like for you? I mean, your baby is about to go under anesthesia. I can't even imagine.
It was very scary. It was very, very scary. I mean, I was already suffering from postpartum depression and especially anxiety. I had it with my son also. I have an older son and he was healthy. I had it with him, and like kind of my biggest fear was something happening to my children.
Yeah.
And then of course, my worst fear did come true with my daughter. And there was a lot of scary times. The one thing, because it was done as an emergency, it was done quick, so I didn't have a lot of time to think about it.
Yeah.
It was kind of like, okay, we got to take her. We're going to go do this, you know.
Yeah.
Then
As much as that doesn't seem like what you want, that's like probably for a mother or father, it's like, okay, like I don't have time to think. This is what's happening, you know, and not the preparation of like, we're going to go to surgery, you know. So yeah, I guess if the options were one or the other, you know, to take a little bit.
They're both. Yeah, because I mean, being done as emergency is it's scary because it kind of, your brain just doesn't have time to wrap around it. It just happens. And it's like, okay, this is happening.
Yeah.
And then, of course, I mean, obviously was hoping that this would help her, and then find out there are other issues.
Yeah, other underlying issues after this CT scan. So they've now realized that artery is putting pressure. So at this point, have they then, I guess, kind of diagnosed her with the 3 combined because of...
Not yet.
Okay.
Not yet. At this point, they just had her as the laryngomalacia, which they did do the surgery for. And then now they diagnosed her with innominate artery compression is what they call it.
Okay.
And which is different from the malacia. The malacia is a collapse in the airway. It's when the airway collapses. And then the compression is when there's something actually pushing on it.
Okay.
So at this point, they said she has the innominate artery compression. And they said they wanted to give her some time after having the other surgery to see if that helped her breathing enough that she wasn't going to continue to have issues. So we waited a few months to see how she would do. It seemed like at this point, like that noisy breathing we were hearing on the inhale had gotten better. But we were hearing noisiness now that was more prominent on exhale now, which noisiness on the exhale is more along the lines of the lower airway malasias and issues like trachomalacia and bronchomalacia.
Okay.
So now that we knew that she had the compression on her trachea, that made sense.
Okay.
But she continued to have issues.
Yeah. We have to take a commercial break, but we're going to get right back to this right when we come back from the break. And I know we'll get to actually meet Miss Landrie Ash as well. So stay tuned. We are going to go to commercial break. We have a little bit of footage of this precious little 6-year-old girl that you're going to get to see during the commercial break. And we will be right back with you to continue learning about her story. Imagine hearing the news as a parent that your child has been diagnosed with a condition that is degenerative or life-threatening. Now imagine being told that there's little to no research for the condition that even exists, making it difficult to try and figure out what to do next. The reality is that for so many rare conditions, finding specialists who understand the condition and being able to make informed treatment decisions for their child is very challenging. Each episode, I will help with my network of physicians and medical resources across the U.S. to attempt to connect the dots by bringing widespread recognition of rare conditions and connecting families to the best treatment, clinical experts, resources, and support. I'm going to highlight these hard-to-diagnose diseases and offer in-depth awareness for families of children in the rare disease community. I believe we are all in charge of our own healthcare, and pushing for answers and creating awareness for these various rare health conditions can make the world around us a better place. Not only am I a huge advocate who seeks to spearhead the fight to bring rare conditions to the forefront of research, but I personally had my own rare condition. In this rare condition, I was able to be cured of due to early detection. My passion to help others was fueled by that experience, and it has led me to start the Hatching for Health show. Now, this show is a vehicle for us to create awareness to help these children find cures. Hi, I'm Jessica Hatch, the host of Hatching for Health. We are a show that was brought about to create awareness for children with rare diseases, disabilities, and disorders with hopes of finding cures. We are looking for doctors that would like to participate in being on our episodes and possibly even bring their own patients on the show to talk about how they have helped cure them, whether it's been surgically or through medication or any sorts of ways. We think that it's very inspiring for others to learn these stories and to possibly help somebody else. So I encourage you to reach out if you are a doctor who is interested in being on the show and allowing us to highlight not only you, but the work that you've done for a child. You can reach out by emailing at info@hatchingforhealth.org. That's info@hatchingforhealth.org, and we look forward to hearing from you. We are coming back from the break, and we have Nicole Minger and now her daughter with her, Miss Landrie Ash. So we were just talking about the multiple diagnosis that your precious little daughter has. And so Landrie, thank you for joining us for a little bit. How are you today?
Good.
Great. So you're 6 years old.
Yes.
What grade does that put you in?
Mr. Beefy.
Of
Sorry.
course, Mr. Beefy.
Seriously. That's it.
Is that your little pager, or do you have your own phone?
It's her. It's her feeding pump was beeping.
Okay.
Yeah.
Okay. Well, tell me about that. So you have, that tells you that you've got to go and do a feeding? Is that what that is?
Mr. Beefy? What does he do?
He helps me. He gives me liquids.
Your liquids in your formula.
Oh, wow. So very good.
Into your belly.
Mm-hmm.
Okay, so you have that connected to your stomach? Or does it go through a different little tube?
They can't see down
Okay, so it's a feeding tube on your belly. Oh, wow.
there. Yeah, your GJ tube, huh?
Yes. I used to have a G tube.
A
Yeah,
J
we switched
tube?
it to a GJ.
Does it hurt at all, or is it doesn't hurt for you?
No.
No? Okay. So is that how you consume all the food, or do you use that just to get certain nutrients?
It's only liquids.
Just your liquid.
Yeah, she gets her liquids and 50% of her calories into there, and then the other 50% she can eat orally.
Okay.
I can't. I know.
Yeah, she can't drink any liquids by mouth.
Okay. Has that always been the case since?
For the last 4 years, she started aspirating all thicknesses of liquids into her lungs. That we
Okay.
figured out about 4 years ago.
Okay. Wow. So your mom was just telling us about the different conditions that you got diagnosed with, and you are just adorable. Oh my goodness. I just want to squeeze you. You're so cute. So before the commercial break, Nicole, if you want to touch back on, so the other two conditions, I guess at this point, you know, you're revisiting the hospital because she's continually, I guess, having kind of now the deep set breathing that you're hearing, kind of leading to another. So tell me where you were at with that.
Yeah, so at that point, yeah, we had went, uh, she'd obviously had the surgery for the laryngomalacia, and that's when they found the innominate artery compression. We got back home and kind of let her heal from the surgery to see how she would do, but she continued to have some of the breathing issues. So they decided to send us to a cardiothoracic surgeon, and he went ahead and performed a surgery called an aortopexy, where
Okay.
I know that's a crazy one, huh?
Yes, it's weird.
What they did is they moved her aorta, which in turn would move that innominate artery. They moved it forward and sutured it to her sternum to get it off of her trachea.
Okay.
And this is a, pretty major shit on the girl.
And she's
surgery.
not even, so this is, she's still not even 1 year old. I mean, she's in her first 12 months of life,
Yeah,
and she's now undergone 2 surgeries, major surgeries.
They decided, she was about 7 months old when they decided to do the aortopexy.
What was the recovery like? Was she had to stay in the hospital, or did she come home the next day?
She was in the hospital for a few days, and honestly, she recovered very quickly. I was surprised because, they cut her on the front of her chest area, and I was expecting her to be a lot more sore. The doctor had told me that kids are honestly bounce back very quickly, a lot quicker than us adults do.
Yeah.
And I'd say within a week, she was pretty much back to normal, typical 7-month-old.
Really?
At that point. Yeah, I was shocked at how quickly she actually did bounce back.
That's incredible. So I guess with these she's had the 2 surgeries, and now, I guess at this point her breathing is improved. At that point, was she still able to bottle feed, and was she taking in, the bottle? I guess, so you said early on it was really hard to get her to eat it all. It was just very slow. So now that was normal from the first surgery.
Yeah.
Mr. Baby Shush.
So yeah, at this point she her breathing was better. Here we go. Her breathing was better, and she was able to drink her bottles, and she had to be on thickened liquids though. She had to be on thickened liquids though because of she did aspirate on thin liquids, but she was doing pretty good with that. Her breathing was pretty good at this point. She did have some issues like moving towards solid food. She really struggled with solid foods. Had her evaluated and learned that her mouth muscles were all very weak. She wasn't moving the food around and chewing it, so she had to do therapy for a while to kind of strengthen all that up so that she could eat solids by mouth.
And all of these, I guess collectively, all of these different conditions that she was, I guess some she was diagnosed with, but then cured of, the one with the heart, that actually, she basically got cured when he did that particular surgery. But does all of this happen whenever she's in the womb? These aren't things that are caused, during labor or due to a genetic, what exactly is it?
It's a development thing. Now, they don't know exactly what causes it, to be honest. Some say genetic, some say not. It seems like a lot of families do have more than one child that has these conditions. There's some families that only have one child. Nobody really knows exactly, but it seems like for the most part, they can develop during during pregnancy, during development. Now with tracheomalacia and bronchiomalacia, those can also be acquired. Adults can get them also, like repeated chest infections, being intubated, things like that can cause them down the road also. There's quite a few adults that have them. Now for her, we do believe hers was from birth.
Yeah, definitely. So
that's what we kind of Oh, let me sit up. I hurt Mama's legs. laying
Landry,
down my
whenever
back.
you jump around, I don't get to see your face move. I get to see a blur of you. So, Landry, tell us a little bit about about school and your friends and everything. Do you you seem like you would fit in anywhere you go with your little energy. So, do your friends understand? You know, do you kind of talk about your feeding tube, and how do they react to you?
They just say, why do you wear the backpack every day?
Okay,
For
and
some
you
reason.
tell them? What do you tell them?
And do you tell them you can't have liquids by mouth?
Yes. I forget.
Does are you still able to do certain like exercise and play with that tube in, or does it restrict you at all? You're able to? No?
Oh yeah, she does all sorts of stuff, huh?
Yes.
Uh,
So it doesn't. I guess it doesn't hold her back from what she wants to do. Okay, that's
Nah, she can
great.
do pretty much anything with it. She just has to be a little more careful so she doesn't yank it out. But
Okay.
honestly, she plays, she runs, dances, jumps on trampolines, rides. I mean, you name it.
Really?
Yep.
And so it's connected from her stomach, and then it goes. Y'all keep it in like kind of a backpack, the fluids in there, and then she wears it.
Yes. She ow, you hurt me. Yeah, she wears it on her back, but yeah, her feeding pump and then the bag with her formula she's on goes in the backpack. And here's her backpack she wears.
Okay. So y'all don't actually remove it at all. It's only, I guess, removed when she goes for like a checkup. Does it stay connected?
The tube itself stays in her, and she's hooked up to the feeding pump pretty much all day, because since she's fed into the intestines through the J tube,
Okay.
she has to be fed slowly. So the pump helps it go slow.
I see.
So she feeds into it and gets stayed hooked up until she gets how much liquid she needs.
Okay, and that's specific to the first condition she was diagnosed with, or which of the conditions does that relate to?
Well, we are not exactly sure because she's always had issues with the aspiration, but it seemed like it got worse as she got older. It got worse after other surgeries that she had. And they're not exactly sure why it got worse, to be honest. Nobody can really answer that question.
Okay. But that is tied to it. Tell us just a little bit about, I mean, you have another child you mentioned, and do you have just a boy and her, or do you have any other kids too?
Yeah, I have a boy and a girl.
Okay. So how has it like affected just the family dynamic, having, one child that doesn't have any kind of conditions versus the other?
It makes it difficult because unfortunately there's been a lot of times I've had to be away. Me and her's been in the hospital quite a bit. Like later on, we also started traveling out of state because our local hospital couldn't care for her when we found she had other issues. So we traveled. So, that's kind of hard on my son, me being away, her being in the hospital, all the surgeries. There's definitely been many times that, we were planning on going somewhere and then we couldn't because she got sick. She gets sick a lot because of the airway issues. And so it's definitely disrupted plans quite a bit.
Yeah,
so
I can imagine.
that is hard on him. And I said, my son also, he was only 3 at the time, but he also witnessed when she stopped breathing and she had to have CPR. He was only 3, but he still remembers it now. He'll comment once in a while talking about when his sister turned blue.
Oh, goodness.
And he's asked me questions as he got older and started to understand more, when he started to learn about health and about, your lungs and breathing and stuff. He even asked me, he goes, did she die?
Right.
during when she stopped breathing, knowing that he needs to breathe. So, I mean, I know that's kind of hard for him
Yeah.
too, just being so little to kind of process something that even
Of
us adults have a
course.
hard time
Yeah.
processing.
Of course. Well, two things I want to touch on because we do have to wrap up. I just would like to know organizations you're a part of. Is there anywhere that you would send another, mom or dad or family member to, like a website or, a group that they could join so that they could learn more about, the things that you go through and kind of without having to live through, be able to learn ahead of time? Is there an organization that you're a part of?
Yeah, I'm a part of two organizations that have helped me a lot. Coping with Laryngomalacia Incorporated has helped me, and
Okay.
also Cure TBM.
Okay.
They both
Fantastic. And
helped me a lot.
I'll have to get those from you to put below as well for others to go to. And then is there just any advice that you have for other parents that are, just learning their child has been diagnosed with one of these conditions?
Honestly, do your research. Definitely join the groups to learn, because the parents on there have so much information. I learned so much from them. And also, if you're not really getting the help, because unfortunately these conditions are not well known, even in the medical community. There's a lot of misconceptions about them. That's why we ended up, when we tried to get her diagnosed with the tracheomalacia and the bronchiomalacia,
Yeah.
we had to travel out of state.
Okay.
So they
Yeah. So definitely just do the research
connect
and
the information. And yeah, if you're not getting the answers, don't be afraid to get a second opinion, even to travel, because you might need to travel to somebody, the ones that are actual experts in it, to get the diagnosis and the treatments.
great.
Because we took her to Boston and she got the treatment for the tracheomalacia, that they developed a new surgery for that most places, not too many other places that do it right now.
Okay.
And it helped her quite a bit.
Great. Thank you so much. There's so many more questions I feel like I have, but we do have to wrap up. But I really appreciate you. You were talking about 3 conditions in one, so we're like trying to cover a lot. But you've taught me, more than I would ever thought I would learn in the last 30 minutes. So thanks for being here and being vulnerable to tell your story and allowing us to meet your little girl. So God bless you, and we'll be in touch.
All right, thank you.
Awesome. And thank you all for tuning in to another episode of Hatching for Health. We'll be right back here with you next week at 7:30 p.m. And I hope that you learned something about another one of these rare conditions in the world that it's just really hard to know the answers to. So if you have any questions, please don't hesitate to reach out, and we'll be more than happy to connect you with some of these organizations and even the families.